Hi everyone, my name is Lucky Malonzo Flores, a student nurse from Systems Plus College Foundation, and today I'm going to show you my return demonstration in assessing my patient's ear. And it's really important for us to conduct an assessment into our patient's ear because ear is considered as a crucial part of our body after the brain, and it's also called the balance system of our body. In conducting an assessment into checking the patient's ear, it is really important to follow the privacy of the patient. We have to make sure that the curtains are closed and the door is closed as well. And before conducting the return demonstration or the assessing the patient's ear, we have to conduct an hand hygiene. We eliminate all the microbes that is present into our hand so that we can avoid the cross-contamination from nurse to patient, patient to nurse, and patient to patient. And then after doing the hand rub, that's the time for you to wear a glove. So but today, glove is unavailable, but we're still gonna continue the assessment. And then after that, we're just gonna need to introduce ourselves to our patient and ask the patient's information too. And it's really important for us to check the name and the date of birth of the patient so that we are sure that we are talking to the right patient. And then after that, we're just gonna get the subjective data or the data that it came from the patient. Hi ma'am, my name is Lucky Malonzo Torres, your student nurse for today. Can I please have your name and your date of birth, please? So thank you so much, Ms. Girly. So today we're gonna do an assessment or we're gonna do a checkup of your ear so that we can see any abnormalities and if there's any so that we can do an intervention. And no worries, I'm gonna provide all of the information that we're gonna gather here at your attending position. So I'm just gonna ask some series of questions, and if you have a question for me, don't hesitate to ask. Okay? Thank you so much. So first thing that I'm just gonna ask is your current symptoms. Into your ears po, do you experience any hearing problem? How about pain po? May masakit po ba? And kapag po may mga naririnig ko yung mga sounds or vibrations, do you hear any cracking or ringing sensation? Okay, so it's really important for us to ask if our patient can hear a crackling or ringing sounds into their ears because if you are experiencing these symptoms, it can be an infection or impacted earwax, or it also is symptoms of a disease or what we call Meniere's disease. So thank you so much for answering my question, Miss Girly. How about into your history or to your medical history from the past? Do you have any medical procedure into your ears? Any operation? How about to your family history? Do you have someone into your family that has a problem into hearing or deaf? And it's really important for us as well to ask our patient if someone into their family member having problem into hearing because if ever that our patient having problem into their ears and then someone into their family member having problem into your ears, it is a big possibility that it is a bloodline disease or it is a disease that it came from their family. Can you ask Miss Girly if you are in an environment that there is a noise? Thank you. How about using a protective into your ears every time that there is a noise? Like for example, doing an activities, you're gonna do a swimming. Are you wearing like an earbuds for you to protect your ear?
Minsan.
After getting all of the subjective data from the patient, let's move on to objective data. And getting the objective data, all we have to do is inspection and palpation. In inspection, the first thing that we need to check is the external ear structure of the patient. So, ma'am, now we're gonna conduct checking your ear external structure. So allow me to touch your ear. So now I'm just gonna check for the color of the ear, the size and shape, if there is any discoloration or discharge. And then after checking the left ear of the patient, let's move on to the other ear. Thank you. So far, ma'am, the size of your ear is normal, same with the color, and there's no discharge. And now, let's move on using an otoscope. An otoscope is a pen light where you can use to see the internal ear structure of the patient. So now I have here a phone with a flashlight, and let's pretend that this is an otoscope, since otoscope is unavailable. So let me just check the internal structure of your ear by pinching it backward and then down. So far, upon checking the ear of my patient into its internal structure, everything is normal. Upon palpating the ears of the patient, and let's do the same with the other ear. So same with the left ear of the patient. Upon checking the ear of the patient, everything is normal with its color, size, and discharge. Since we're done with the inspection and palpation, now let's move on in doing some tests to check if the ear of our patient is normal. So today, we're gonna do a 3 tests, which is the whisper test, Weber test, and the Rhine test. So with whisper test, all I need to do is to ask my patient to cover his ears, and I'm just gonna whisper at his back, and let's try if the patient can still hear it. So, Ma'am Hurley, can I ask you to to place your hand into your ears, cover it, and then I'm just gonna whisper at your back and try to say what you hear, okay?
The weather is fine.
So, I whisper, the weather is fine, and Miss Gurley or my patient successfully hear. So, meaning to say that the ears of my patient, it's normal. So, let's try to the other side, Ma'am Gurley. Systems
Plus College Foundation.
And again, my patient's Miss Gurley successfully mimic what I said, which is Systems Plus College Foundation. So that is just for the whisper test. We are checking if there is a hearing loss, but so far everything is good. So after the whisper test, let's move on to the Weber's test. In the Weber's test, what we need is a tuning fork. So since we don't have a tuning port, let's just pretend that this lotion is a tuning port, and I'm gonna show you on how to use a tuning port. So tuning port, it's just like a fork, but it has only two fork at its top. So all you have to do is to pinch it to create vibration, and then after pinching it, you just need to place it at the top of the head of your patient, and then ask your patient if he or she hear the vibration into his or her ears. So that is just the Weber test. All you have to do is to pinch the fork and then place it at the top of the head of your patient, and you just need to ask your patient if he or she hears the vibration until the end. And that is just for the Weber's test. And now let's move on to the Rhine test. Rhine test is we are still using the tuning fork, but in tuning fork, we are checking if the air conduction is longer than the bone conduction. So all you have to do is to pinch the tuning fork again and then place it into the ears of your patient. And all you have to do is to ask your patient if she or he hears the vibration until the end. You just need to check if the air conduction is longer than the bone conduction. And all you have to do is to do it into the other side again. So that is just the three tests for today. So Miss Gurley, thank you so much for your cooperation. We are now done with the checking or assessing your ears. So what we have here, upon checking all of the information or gathered information here from inspection, palpation, and doing some tests, everything is normal. So all we just have to do is to have a great and healthy habit or healthy lifestyle which connects into our ear, like trying to avoid noises and eating some healthy foods that help to have an healthy ears. Okay? Thank you so much.